Hello and welcome in everybody, X3VerX. My name is Ryan. This is going to be part 2 of my brain tumor journey. If you didn't check out part 1, it's going to be down in the description, so go ahead and check that out. So part 2, guys. Part 2 is going to be discussing between watch and wait, radiation, or surgery, and what led me to decide on getting surgery out of all 3 of those options. Ooh, dog, yeah, to give me some of this water. It is 85 degrees out while I'm recording this. You guys need to make sure you stay hydrated. If you're watching this, go get yourself a glass of water, get a cup of water, drink it. I don't know if you guys knew this, but about 85% of the population is actually dehydrated. Yeah, it's true. It's not true, I'm just kidding. I actually don't know what the statistics are on that. But drink yourself a glass of water, your body will thank you for it. So getting into part 2, I had the choice between watch and wait, radiation, or surgery. So these were my 3 options after getting diagnosed with my brain tumor. Now going into all of this, I do need to make the disclaimer that I am not a medical professional and I cannot recommend or give you advice on what treatment will be best for you. I can only offer my own personal experience and my own knowledge going through this. So with the disclaimer out of the way, let's get into the video. So going over all 3 options, we have watch and wait, radiation, and surgery. All 3 of these options are gonna have their pros and cons, just like everything else. All 3 options are going to be scary. I mean, I'm not gonna sugarcoat that. You just got diagnosed with a brain tumor. It's a very hard time. And I know emotionally, you're probably not doing well with that news. But I do wanna say, take a step back, breathe, relax, try to relax. I know it's a very hard thing to take in being diagnosed with the words, you have a brain tumor. It's going to be a very hard time in your life. But I just want you to know, it's going to be okay. Take a step back, breathe, ground yourself. If you need to, if you're having a panic attack, there's a thing that I like to do that I learned through therapy. And it's a simple thing that you can do to help yourself. It's going to be really just taking a step back, finding a comfortable spot in which you feel safe and relaxed, and then focus on 5 different things using your senses. So you're going to look around, you're going to find 5 things that you can see, 5 things that you can smell, 5 things that you can touch, 5 things that you can taste, and engage all of your senses and just really focus on saying like, hey, like right now, for example, I see some rocks in front of me. I see this beautiful tree line back here. I see some pretty pink flowers. I see the nice blue sky, the clouds. I smell the crisp air right now. I can smell the water that's over here right at the lake. I can smell the pollen off these flowers, which actually is not good for me because I have really bad allergies. But again, these are just some examples that you can do if you're having a hard time with panic attacks and getting the news that you got diagnosed with a brain tumor. So hopefully that helps. I really hope it does. It helped me. It still helps me when I have panic attacks to really just do all those steps that I just mentioned. Really what it is mindfulness. It just kind of comes down to mindfulness, and part of it is like initializing cognitive behavior therapy. We'll go over that. That'll be a whole nother video. I'm getting kind of off topic here, so I apologize. So coming back to watch and wait, radiation, and surgery. So depending on the symptoms that you're having and the location of your tumor, so having the brain tumor vestibular schwannoma, commonly referred to as acoustic neuroma, so having that tumor can be anywhere on the vestibular nerve, facial nerve, auditorial nerve. So depending on where the tumor is at and where it is pressing at, will give you different symptoms and ultimately will dictate what approach you're going to have to take with this tumor. So when it comes to watch and wait, radiation, and surgery, it's all going to depend on the treatment that you want to go with, as well as the symptoms that you're experiencing and the team of doctors that you're working with. Now when you get diagnosed with a brain tumor, I would highly suggest you go through and meet with multiple doctors, meet with multiple radiologists, meet with multiple neurosurgeons, and get different opinions from all these different doctors. It does not hurt to go and meet with multiple doctors This is a very big decision that you're going to have to make. It's not going to be an easy decision by any means, and it's going to be hard. It's going to cause you a lot of anxiety. It's going to maybe cause you to be angry or upset and go through the whole process of grief of, oh God, why me? Why do I have a brain tumor? Why do I have to experience this? Like, why me? You're gonna go through all these things. You know, I'm not gonna sugarcoat anything. It's going to be hard. I get that. I'm a walking testimony of that. I went through this. I continue to go through this. You know, it's a huge thing. It's a huge, huge thing. Especially when I was 26 years old. I'm 30 now. My birthday was just a few days ago. Celebrated my dirty 30, which is crazy to think about. I actually did not think I was going to make it to the dirty 30. But I'm here. I'm blessed. I'm very happy that I'm, you know, 30 years old now. But, you know, looking back at 26 is when I got diagnosed. I had my surgery at 27. I turned 27, and a week later, after my 27th birthday, I had brain surgery. So yeah, I just celebrated my 30th birthday. It's a very good birthday, and I'm very, very blessed to be here still. And I'm very happy to be recording this video for you guys, and I hope it helps you. July 28th is my anniversary for my brain surgery. So today, recording this video, it's July 26th. In 2 days, it'll be my anniversary celebrating my acoustic neuroma, vestibular schwannoma. And yeah, I'm looking forward to doing that. I like to celebrate it every year. It's a big thing to me, and with you watching this video, it's going to end up being a big thing for you as well, you know, because you got diagnosed with this brain tumor, and I get it. So going back though to watch and wait and radiation and surgery, I know I get so scatterbrained when I'm doing these videos, and I apologize. It's part of my surgery. I just get very scatterbrained, and I'm very forgetful since surgery, but I'm trying my best to keep this very streamlined and appropriate for each topic. You're gonna work with a whole different team of doctors. Get multiple opinions. It does not hurt to get multiple opinions. I highly, highly recommend it. I would personally recommend trying to get in touch with doctors that are specialized in treating vestibular schwannomas. Website you can go to is the Acoustic Neuroma Association website. They have a host of information that's gonna be so beneficial to you and your family members going through this. It can also get you in touch with different doctors that are specialized in this. So that would be a great place to start if you're, you know, trying to find some research on where to reach out to find these doctors. You might have to travel out of state. I went to the University of Cincinnati here in Ohio, and I had an excellent team of doctors that treated me. I highly recommend their team there at the University of Cincinnati. So depending on where you're at though, that's gonna, you know, determine what kind of treatment you have and what's going to be available to you. I had to take a water break. So watch and wait. Watch and wait is exactly what it sounds like. It's just where you watch and wait to see what the tumor does. Now statistically, these tumors are slow growing. They don't typically sporadically shoot up in their growth. However, there are cases where they can just sporadically grow out of nowhere, and in my case, that's kind of what happened. Is my tumor just kind of shot up and started growing exponentially really quick and causing all these symptoms out of nowhere, because I was really fine, and then February 1st 2020, out of nowhere, I was just having all these host of symptoms. It was because my tumor just really shot up in growth and then started causing all these symptoms. So again, with watch and wait, what they'll do is you'll have the tumor inside your head still, and you'll come into the doctors every so often. I think it's every like few months to every 6 months to every year, and then yearly you'll just come in for your CAT scans and your MRIs to see what the tumor is doing. Now watch and wait is typically more so recommended for older individuals. Those that are like, you know, older age, you know, 60 and above are usually the ones that I recommend watch and wait, and that's mostly because, you know, you're an older individual, and if you're not having symptoms, there's no point in really going in and treating it, you know, when you're of that age, because you're, you know, you're older. And typically radiation and surgery is harder for individuals that are, you know, older of age, because they're not as young. They won't be able to bounce back as quick as a younger individual. So watch and wait is going to be typically for individuals that aren't really having a lot of symptoms and aren't really, you know, being affected by their brain tumor. and feel okay with knowing that the brain tumor is inside their head, you know. And for those that might be of older age, watch and wait is going to be most likely more an appropriate treatment for those individuals. Now coming into radiation, there's going to be different options that you can go with. Gamma knife is going to be one of the most well-known radiation treatments when it comes to treating the vestibular schwannoma brain tumor. Now you're going to have to talk with your doctors regarding the radiation options. Typically though, radiation, you're going to get so many doses of radiation. It's going to be a non-invasive type of option that you can go with, and the goal of radiation is going to be to stop the tumor from growing and hopefully shrinking the tumor. Now it's not going to get rid of the tumor is still going to be there, but the goal of radiation is going to be stopping the tumor from growing more, and then to also shrink the tumor with the doses of radiation that you'll receive. Now even though radiation is a non-invasive treatment, you might still actually experience some of the side effects of what you would experience with surgery, and those side effects can include dizziness, loss of balance, hearing loss, ringing in the ear such as tinnitus, dizziness, headaches, migraine, feeling really woozy and kind of, you know, off balance and feeling tired. So those are some of the side effects that I'm aware of. I didn't go with radiation. When I met with my team of doctors, they actually told me radiation was not a good option for me personally. Again, this might not be the case with you. This is why I said you need to meet with multiple doctors and find out what's going to be the best option in treating your case, because every brain tumor size and location, it's not going to be the same. You know, some patients can have one size of the brain tumor and location of that brain tumor, and then another patient can have that exact same size and location of that brain tumor. But then looking at both patients, one can have this many symptoms and then the other can have no symptoms, you know. So it's a very individualized approach when it comes to deciding what's going to be the best option for me personally, okay? So again, you're going to meet with a whole bunch of doctors. I highly recommend meeting with multiple doctors and then taking in all the information and then kind of taking a step back, doing your own research and reaching out to others that have gone through these types of things like myself. There's a lot of support groups that you can find on Facebook. That's going to be a very helpful place to look and getting more personalized information on, you know, actual individuals like, again, myself that went through something like this. Now hopping back to radiation and why it wasn't good for me, my doctors told me radiation was not a good option for me personally because of the symptoms that I was having and because of the location of my brain tumor. So my brain tumor was actually pushing into my brain stem and starting to compress my brain stem. And over time, if that continued, I was actually looking at respiratory depression. And that actually goes back to my first video when I had my dream about having a brain tumor weeks before I got the diagnosis. And, you know, my doctor did tell me, you know, over time, if this continues to grow, you're looking at respiratory depression, which I would end up passing away from. So the radiation option just wasn't the correct option for me. And then they also told me that there could be a causation of brain cancer from the causation of radiation. Now, again, this is something you want to discuss with your doctors. For me personally, I didn't want to take that chance either to have the radiation turn into brain cancer. So now we're here to the last option, which is going to be surgery. Now surgery, there's typically 3 approaches that come with surgery. The first approach is going to be the retrosigmoid approach. The second approach will be the middle fossa approach. And the third approach that's typically done is the translabyrinth approach. So all 3 of these approaches are really just the different ways in which the surgeon's going to go into your head to get to the tumor. So when your physician is going over the 3 approaches with you, they're going to go over and ask you different questions and symptoms that you might be having. I know the hearing that you have is going to be a big determinant to what approach the physician takes with you. Now in my case, I had a combined approach of retrosigmoid and translabyrinth, and that was because I relatively had good hearing still in this ear before the surgery. So the retrosigmoid translabyrinth approach that they did was to go in and try to preserve the hearing that I have. And thankfully they were able to preserve my hearing. Now I did lose quite a bit of hearing with the surgery, and now I do have a constant tinnitus from the surgery. But I am very thankful that I am able to hear out of this ear. And I did do a year of therapy with an audiologist to retrain my ear to accept sound, and eventually got approved for my hearing aid here, which has been a blessing. I love this hearing aid. It has been a game changer for me. So that's something you're gonna again have to discuss with your doctor though. Now I'm gonna be honest with you guys. You guys know I like to keep things very honest and transparent here. Surgery is a very, very hard thing to go through. I'm not gonna sugarcoat it. You know, I love to be as transparent and honest as I can with you. Surgery was hard. It was the hardest thing that I have ever endured and continue to go through. I'm still in recovery. You know, I had my surgery July 28, 2021, and at the time of this recording, it's July 26, 2024. So in 2 more days, I will be at 3 years since I had my brain surgery, and I'm still recovering from it, you know. It's a very hard thing to go through, but surgery might be your best option. It was my best option. And I am happy that I went with that route out of the other 2 options. Again, radiation might be a good option for you. That's something that you're gonna have to decide and work with your team of doctors to come to the conclusion of. So before we wrap this video up, I do wanna go over some of the symptoms that I do think you should be aware of regarding radiation and surgery. Now I'm gonna be speaking on surgery specifically, as I did not have radiation. So some of the symptoms that I have from surgery are tinnitus, neural pain. I got diagnosed with trigeminal neuralgia as well as neuropathy. So I deal with a lot of nerve pain still ongoing from surgery, which it's been a very hard thing to deal with. And then I also have tinnitus, and that is 24/7. So I have the ringing in this ear that has not gone away. I also have hearing loss that was induced from the surgery. Thankfully, I am still able to hear. I did a year of hearing therapy with the audiologist and got approved for a hearing aid, which has been a blessing. It's been a godsend. Now I also have a vestibular disorder. So I was diagnosed with the vestibular reflex disorder. And basically what that means is I have a disorder of my balance system. So from time to time, I get really lopsided feeling. It goes back to what I talked about in my part 1 of this series. So from time to time I do feel lopsided, and I have issues with my balance as well as dizziness and just really feeling wonky feeling. And that's typically induced more so when I'm more tired, stressed, or doing more physical activity, especially when I go to the gym and I'm exerting more energy and, you know, doing more like physical demanding things. It really aggravates my symptoms. And then I also just have this like constant feeling of tiredness. I feel very tired and fatigued a lot of the time. And I also experience migraines and headaches quite frequently. Now these are just some of the symptoms that I experienced from my brain surgery. This isn't to say that you will experience these symptoms with your brain surgery, and with radiation you might not experience these symptoms. Again, this is my own personal thing that I deal with from my surgery, but I just like to be transparent and educate others on possibilities that could happen. I do want you guys to take your time and really just take everything in, make a very informed, educated decision. This is a very big decision that you're gonna have to make. And I want you guys to be educated and aware of things that can happen and things that might happen, you know? So this is part 2 of my brain tumor journey. Part 3, we're gonna go over the symptoms and take a deeper dive into the symptoms of everything that I deal with since my brain tumor and surgery. So that's gonna be part 3. I hope to see you there. So thank you so much for taking the time out of your day and watching my video. It really means a lot to me. And I really hope I am helping someone out on the other end of the screen watching this. This is the whole sole reason of why I'm making these videos, is to hopefully help somebody else going through this. and to just bring comfort to somebody else, you know. So hopefully my videos are doing that, and we'll catch you on the next video. As always, peace and prosper, much love. We'll be seeing you on the next one. Like